So this is just a little video about confining your dog, and this is sometimes one of the hardest things that we get pet owners to do. However, it is really important if they've had some sort of an advanced spinal surgery, or we're trying to protect a wound, or an orthopedic implant that is being used to repair a fracture, to reduce the number of cycles that go through that implant. So there's a few things that are really important and that can really help, and one of them is to just make sure that they're in an area where there's nothing that they can jump onto or off of. So like, for example, this couch that Teddy's trying to jump off of, that would be a no-go when they're in confinement. When they come out of confinement, it's really important that they are attached to a harness and lead, and that they are on the lead at all times when they're out of their little confined area. When they're in the confined area, they will sometimes jump up on their back legs, and there's nothing much that you can do to stop this, but they're unlikely to do any damage with that specific maneuver. So don't worry too much about that one. It's really important that they don't run up and down the stairs, run along slippery surfaces, or run around the backyard without the lead being attached to them. So really it's just gentle toilet walks out to the toilet and nothing much more than that. It's important to give them lots of things to do when they're in that confined area. There's lots of toys and things available online. There's even special rehab packs that you can have access to, which can entertain dogs when they're in that confined area. And we can also help out by prescribing some sedation drugs. One of the examples of such is a drug called trazodone, which can just help to keep them calm while they're in that confined region. Sometimes it's a huge adjustment for dogs, so keeping them a little bit on the quiet side with sedation can be better than them overdoing it and then having backwards progress and a poor outcome. And in some cases, a poor outcome will lead to needing surgery again, and then them having to go back into a further period of confinement. So we want to get the confinement period over and done and have a successful outcome the first time around. The most important thing when they come out of confinement is to just make sure that they very gradually go back to their normal exercise regime. There's no exact formula, but it may just be something that you increase their exercise by just a small amount each day. I hope this video has helped. However, if you have any questions at all about keeping your dog confined, please don't hesitate to reach out to one of the team at Veterinary Specialist Services.